Welcome to Airway Exchange, the podcast for empowering educators and inspiring future CRNAs, a new series of Beyond the Mask supported by AANA.
We're your host team. I'm Greg Collins.
I'm Nikki D'Amico.
I'm Erin Martin.
And I'm Louisa Martin. We're here to support the community of CRNA educators with conversations to explore, learn, and grow.
To pursue excellence in the evolving field of nurse anesthesia education.
And to champion our students and enrich the future of the profession.
This is Airway Exchange.
Welcome back to Airway Exchange. I'm Louisa Martin, and I'm here with one of my co-hosts, Erin Martin. So we have both the Martins here today. And in this episode, we are very grateful and excited to have Dr. Valerie Diaz and Dr. Pedro Hernandez here with us to talk about item analysis. They presented at EDGE this year, and the title of their presentation was Item Analysis Demystified. And I think that's perfect because I think that many times for many nurse anesthesia educators, when they hear item analysis, they either love it or they cringe and they find it mystifying. So I'm so glad you guys are here to talk with us today about this really important topic for those who weren't able to be at EDGE. Dr. Diaz is a native of New York City. She is an associate professor at Florida International University, or FIU. She's the curriculum coordinator for the Department of Nurse Anesthesiology at Nicole Wertheim College of Nursing and Health Sciences in Miami, Florida. She's practiced nurse anesthesia for over 20 years and has been a member of the AANA since 2001. It's amazing. Dr. Diaz earned her MSN and DNP degrees from FIU in 2003 and 2013, respectively. She's a certified nurse educator. She's also got her CHESI. She's a certified healthcare simulation educator. So she is a seasoned academician with 13 years of experience and an esteemed fellow of the American Association of Nurse Anesthesiologists. Her expertise includes curriculum creation and evaluation. And then Dr. Hernandez is a Florida native and two-time graduate of FIU with his BSN in 2019 and his DNP in 2024. His doctoral scholarly work pertained to generational learning preferences and student academic performance. He currently holds a teaching position as a visiting clinical assistant professor within the Department of Nurse Anesthesiology in the Nicole Wertheim College of Nursing and Health Sciences at FIU. And he practices as a CRNA clinically at Jackson Memorial Hospital, a level 1 trauma center with one of the busiest transplant programs in the region. So did I miss anything? Do y'all want to add anything to your impressive bios?
Well, I always like to acknowledge my 23 years of service to the United States Navy, retired captain. And so the anesthesia that I have administered has been on land and at sea, which people find very interesting. So I always share it.
Very impressive. Thank you for your service. So why does item analysis matter now for nursing anesthesia education?
I'll take that question, and thank you. I think it's a great question. Item analysis, its purpose really is to determine the efficacy and the accuracy of assessment, assessing how our students are learning, assessing our methods of teaching, assessing the learning outcomes for the students, for the program, and if they're working, that translates to community patient safety, or patient safety in general if your graduates are going other places. And that's what's most important. It always does trickle down to the patients.
And many educators feel intimidated or kind of owe statistics. So what do you think fuels that fear or uncertainty?
I think it's a combination of things. I think that when you look at traditional DNP anesthesia programs, some programs have stats, some of them don't. It's very rare that we have a formal nurse anesthesia educator curriculum. And I think that uncertainty kind of causes people to feel like, maybe I'm not an expert in this. I'm an expert in the OR, but this may be uncharted territory. So I think that plays a huge role, actually.
I would say, as an educator, as we all are around the table, that's very, very true. I mean, I think one of the things, and I think it's been addressed already, is that most of us haven't been trained to teach. But I think the fact that you guys are bringing this information and helping those of us who don't have training in this I think it's fabulous. It's fabulous.
Well, thank you. Just the phrase item analysis elicits a cringe from many people.
Yes.
And you're right. As nurse anesthesia educators, many of us were not taught to teach. And so I took an interest in item analysis when I returned for a postmaster's certificate in nurse education. And I said, this is really valuable. It's statistics, but don't shy away from the numbers or the math. The fear will be there, but you just have to do it scared. And then it becomes second nature.
How has you broadening your understanding of item analysis impacted the way that you teach?
It's funny and it's a timely question because when I analyze the items that I write, sometimes it means that I have to go back and re-clarify certain points. We think that what we're teaching, our students are receiving, and oftentimes they are not. Depending on the type of learner they are, maybe the method in which we deliver the information is not the method in which they learn. And so you'll see it in the statistics of a question and immediately take it personally. I know I taught that. Why didn't they get it right? Or something like that. And it's that self-reflection from doing the item analysis repeatedly has made me a better item writer. And I don't take it personally anymore, and I just go back and I re-clarify and reteach, and eventually students do learn it. Our pass rates at FIU are high, and I'm sure they're high at many of the programs across the country. But re-clarifying information to students is really one of the valuable things that comes out of doing that item analysis.
Yeah, I think that for me, it's like, I compare it to my clinical practice. I look at a patient and I say, if their hemoglobin's less than this, I know exactly what I'm going to do. When I was being taught this item analysis, it was very quick to look at the percentage that they got right and kind of determine, okay, if 30% of this class got it right, let's give it back. But now I'm like looking at things a little differently, and I'm like, man, I know I spoke about this. I know that this was taught, and I recently just graduated. So it's kind of like that uniqueness of, I think this is important. I think that this is something that now being on the other side, I could see why the professors maybe didn't give it back when I wanted it back at that moment. Because this is something that I do on a daily basis, and I just didn't know it because I didn't have that bird's eye view at the time. I was still looking up, and it's really intimidating. So I think that's really like the impact that I saw with the item analysis.
That makes me think of something I hadn't considered before. Do you talk to your students about how you do your item analysis? Is that something that you talk to students about so they understand how you're making your decisions with your testing?
Absolutely, because there is this common assumption, especially amongst first-year students, that we just give hard questions just to trick them. They feel if they can argue a point, they should get it back without understanding what assessments really represent and that there is a process for analyzing them. And so once they found that out, it was an eye-opener. So don't get me wrong, they still try to get the points back on questions, but they approach it now from a different angle.
Yeah, I think we're just trying to demystify. We're not trying to weed you out of the program. We're not trying to see you not be successful. We understand the sacrifice. We understand the 3-year commitment that you're undergoing. I think it's just more of, we want you guys to understand where we're coming from. So we do have that conversation with them. We explain to them, this is what the reliability means. The same way that we trust our NCE to rely on the community, that you're a certified nurse anesthetist, I think that we also have that same expectation as faculty. I want that buy-in from my students.
Mm-hmm. And that it's an objective process. We don't pick and choose what we keep or toss, as it were, and that there's no emotion in it because we do it blindly without any names of students, because over the 3-year period, we become very attached to our cohorts. You have to remove that factor from the analysis and keep it completely objective. And once they understand that that's what we're doing, I think they appreciate that more.
I do the same thing. I do a blinded analysis. And as I told you when we were talking a little bit before recording, I'm interested in trying to get better at item analysis and use it as a tool, things change in the clinical world, and we learn about more tools so that we can provide better care for our patients. And this is, I feel like, another wonderful tool that we can utilize to prepare fully competent nurse anesthesiologists. But I asked my students to give me 24 hours. I noticed I've only been in full-time academia for a few years, but in those first couple years, I would spend the first 24 hours after an exam answering emails about questions. And I knew we had this item analysis, but I didn't know a lot. What's this KR20, And so now I ask them, give me 24 hours. Just give me 24 hours. Please don't email me. Let me look at the item analysis, and we get other faculty to look at the item analysis. And I feel like it gives me more credibility, and they like that yes. It isn't me personally deciding, well, you're one of my favorite students. We're not supposed to have favorites, but, so I really like her. I'm going to give the point back, I'm just going to give it back because. And at the same time, another thing that I think that item analysis can bring value to, but maybe a hard pill to swallow for experienced academicians is saying, but I love this question. This is such a good question.
Yes.
I've used this question for 20 years,
Yes. And that's exactly what I mean by removing the emotion from the process. And we always think we're good item writers.
Right.
And I look at a question and I'll say, you went left on this one, Dr. Diaz. It wasn't as good as you thought it was. And it's not personal, because item analysis actually makes you a better item writer, as well as creating more accurate and effective measuring assessments. So it's a twofer. But you said something, and if you will, I'll give you a tip about students emailing. ExamSoft, and I'm not promoting it, but because you use it, has a feedback feature that you can activate, and they can put their feedback into that text box while they're taking the exam. So you'll see what they want to email to you. You will see it when you pull up that data, so that they don't have to email you.
Okay. Thank you for that.
Sure.
I don't know that I want to do that.
I will tell you, it works pretty well.
Yes. It does.
Because after the exam, we know that students will do a quick Control F and try to find the textbook that fits their answer choice. So this is more of like a real time, this was your knowledge, this was your assessment. Why did you think the answer was B when I coded it as C?
Right. So it's immediate feedback
Correct.
for us.
ExamSoft has so many features.
It
that
does.
I'm just now. That's another one I'll have to utilize. So if you had to summarize item analysis for busy nurse anesthesia educators, or if you in a sentence or a few sentences, what would you say? Either item analysis or the importance of item analysis or your buy-in?
Yeah, I think the buy-in is, once again, as someone that is still within my first year as an educator, the same amount of respect and prestige that I see my CRNA colleagues, I think that this is one of those things where we're emphasizing to our SRNAs that, you guys can trust us. We are doing what's best for you, and we're preparing you to take those boards exams and become certified registered nurse anesthetist. So that for me, it's all about the reliability. I think that, it's a 3-year commitment, and they need something in return, and this is a small piece that I could return.
I would add to that by saying remain objective, not emotional, perform an item analysis after every assessment. And I think that establishing that as a standard will help everyone become better at interpreting item analysis. And lastly, probably not use the analysis itself as a rigid tool and make hard and fast decisions always the same by creating thresholds, because every exam you deliver is different, the material is different, and the pool of students that you deliver it to is different. So I think the rigidity of hard, fast rules from item analyses is probably not recommended. I know it's certainly not recommended in the research, so try to avoid it if you can.
So which metric do you think is most misunderstood?
I think what's most misunderstood is probably the most valuable metric, and that's the discrimination measurement. People like the difficulty level because that's the easiest number to determine. However, questions are meant to challenge exam takers, and the challenge is being able to discriminate high-performing students from low-performing students on that exam. So the key correct answer compared to your distractors should really have some value in separating high and low performers, because that's how you determine who prepared and who did not, more so than the difficulty level. So that would be certainly a take-home message. If nothing else, that would be it.
And for those who are just dipping their toe into this, what is that metric?
That metric is the point by serial index, because it compares the entire student group that took it, or the D index, which actually compares the upper 27% to the lower 27%. Either one of those are both discriminatory measurements. So doing that distractor analysis is probably more important than just examining the difficulty level.
And the difficulty level is
The p-value.
The p-value. Okay.
Yes.
So, what are resources that you would suggest a program, or are there resources? And we don't have any sort of, like with ExamSoft, we use ExamSoft, but I have no financial relationship with ExamSoft. But are there resources that you recommend for busy educators who are like, I don't have time for this, or what's one metric they could start with? What do you say to someone who wants to dip their toe in, but is a little intimidated?
I would say do a stepwise analysis, look at your difficulty level, but then scrutinize your PBI, point by serial index, for the right answer and for the wrong answers, and decide whether or not your high performers are getting the question right, or are your low performers getting the question right more often than your high performers, which is counterintuitive, suggesting that there may be a flaw in the question, so that you really need to evaluate, self-reflect, and if you decide there is a flaw, try to correct it in some way. Don't move on from it, correct it then, and then make the decision whether or not to reward a second answer because of ambiguity, or was it miskeyed, or was it something that you thought you taught well, but the learners didn't learn well. So double back, close the loop the following week, and re-clarify, teach it to them again. I've had to do that, as Dr. Hernandez can recall, about liver function tests, etc. And what is
that exam.
what is the best measurement of bleeding time?
Yeah. And I just want to emphasize, I feel like, I don't know if there's a program, but I personally think that practice makes perfect. I've noticed that in my program, each course probably has anywhere from like 4 to 5 exams in a semester. So I do like little knowledge navigators at the end of my each lecture. It's about 10 to 15 questions, and I actually give them the analysis. So I'm like practicing it. So I'm telling them, hey guys, this question, 60% of you guys got that right. What happened? You guys submit a care plan every week. Why didn't you guys know the maximum allowable blood loss? You guys send this in every week. So it's kind of like a good insight, and I feel like that practice with them, not only am I teaching them how to do it, but then there's moments where I'm like, maybe they're not like really strong on this. Maybe there's something that we're doing wrong as a programmer. Maybe there's something that we could emphasize a little bit better, that they're not getting this right consistently. So I like it that way. And then when it comes for the big exam, I'm a little bit better at it because I did it 3 weeks in a row leading up to that exam worth 20% that's the one they really care about. My knowledge navigators are just a little synopsis for me to understand, did you get the learning objectives of this week's lecture?
Are they graded? I'm just curious.
They're not graded, actually. So my classroom's fully flipped. I record my lecture. We do case studies. We do all of that. At the end of the lecture, I ask, 10 to 15 questions that I think are important for them to leave today knowing. And if you didn't know it, then you're not really leaving, because I don't do it right at the end. I kind of do it with 20, 30 minutes left of lecture time. Once they see the analysis, they could see how they performed with their peers. I don't show them that portion. I see that on the back end, what each individual student got right. And, for any student listening, some questions I do reword it because it's important for them to know. And it's interesting to see that once you change those distractors, they still get distracted despite the answer choice remaining the same. It's really interesting. So that's how I do it, at least.
I never really thought about this being a teaching tool. I think that's very insightful that you can find out maybe it wasn't a bad question, but you just didn't teach it. And so I love that idea that if you do find that, it's like, okay, we have to circle back and recover this information.
Yes,
that's
absolutely.
Fascinating.
I definitely take ownership of that.
Yeah. So what happens when you have a bad question? So you touched on that this morning, but can you explain to our listeners, what do you do when you've got that question that just stunk?
So that's a great question, and it's probably the burning question in everyone's mind. That's what they want to know. Tossing out questions. If anyone answered a question correctly, do not toss it, because you penalize students who had the right answer and knew the material, and rewarded those that didn't. What you should do, because obviously there's some ambiguity, is look at the other choices, the distractors, and see which of those probably drew most of your high-performing students, and you may need to give credit for both of those answers if it were a single response question. If it were a multiple response question, which is associated with a little more difficulty, do the same assessment and see which one of these distractors drew a lot of our high-performing students. There was some ambiguity here as to why they chose B, and B was not one of the keys. And you may have to give credit for both. And there's a way to do that in the exam platform objectively, without just throwing away a question because, oh, Sally always does so well. If we throw away this question, she'll pass, sort of thing. So that's what I would recommend.
I like that. It seems like you're saying also that it doesn't have to be rigid. You said, so you don't do the same thing every time with every bad item or borderline item. Am I hearing that correctly?
That is absolutely correct. Each exam is individual. It takes on a personality of its own because your test takers have their personality as well. Every time you give a question, you're giving it to a different pool of students. And so you have to evaluate it on that basis and not be rigid and establish a rule for everyone. It's not universal.
Yeah, and get a second opinion. I'm really quick to go across the hall and be like, hey, are you busy for a second? Take a look at this. I'm on the fence of giving this back. What are your thoughts? You didn't sit in my lecture, but you're still a content expert. Would you have put B? Or could you justify the 25% to put C? Do you see where they're coming at? And have that conversation. Removing pride aside, sometimes they're like, Dr. Hernandez, you're right. C could have been an answer. And I'm like, yeah, let me go back and give that credit because maybe I misinterpreted it and miskeyed it. Better, next year it won't happen again. I'll change the question. But for this time around, the student shouldn't be penalized for something that maybe I made the mistake on.
I love that in an educator. I love that in a nurse anesthesiologist who's full-time at the head of the bed still, is that ability to look at yourself and say, what could I have done better? Not, this is my exam question, and I know I taught them this, and I'm not changing it. They're the student. I'm the teacher. I love that. I love that, to hear that in both of you as educator, a novice educator, a very experienced educator, that ability and willingness to say, you know what, I was wrong or I messed up, and I try to, because that, I'm sure you're the same in the OR when you mess up. We all mess up. We all want to do better the next day, or sometimes we mess up, but nobody's perfect. So, I think it's good for us to show that to our students, that we are human beings.
Yeah.
Yes.
And I want to emphasize, throwing it out or doing something like that doesn't mean it's not still important. So I will revisit the topic at the next lecture, and I'm a big proponent of scaffolding knowledge. So I will ask the question again. I may not word it the same way, but that concept will be asked again, especially if I took the time to re-emphasize it in lecture. So I just think that like those little things kind of help solidify really important things that we do.
Yeah, I like the phrase you use, or what you call I would call it a quiz, but I like knowledge navigator.
Yeah, I recommend it. I mean, you should see some people will go and they'll argue me still on the knowledge. It's not even worth a grade. And they're front and center. Oh, but we put A because of this. And I'll be like, it's interesting. 70% of you put A. Maybe I said something in the lecture in my recording that made you think A. So I actually welcome them to come and why did you put A? And explain it. And I'll take ownership. I'll be like, oh man, let's go back. Let's backtrack. Let me get my white marker and I'll start writing on the board. This is why it's B, and I'll clear the air. But yeah, it's nice. The Knowledge Navigators, I highly recommend it.
It's a great way to wrap up a module or a lesson plan. I did a presentation for early educators, and you have objectives, etc., but at the very end, wrap it up with a Knowledge Navigator to see what the students actually got out of it.
Yeah, I like that. We do a lot of flipped classroom where I am, and many of us do a quiz at the beginning. But one of my colleagues started doing them at the end of class because, they're expected to watch the pre-recorded lecture before they come. But I've been doing them at the end of class this semester, and I'm going to now start calling them knowledge navigators, like I said.
I do my quizzes during the recording. So we use a platform that the student can't rewind or fast forward, and I do a few versions just in case they like to group think or group study. So for that reason, I create a few variations of a concept, and they must answer the question to progress in the video. In real time, I get that information, and it's good feedback for me. And then at the very end, I tell them to identify the one concept they felt was hardest for them. Typically, they'll all write the same concept. And then I ask them to give me one multiple choice question that they write themselves. And I actually use that as a knowledge navigator. Little fun fact. I select the 15 that I like the most, and they wrote it themselves. So now they're seeing this is what your peers felt was important. Sometimes it's like really granular. Other things are like very broad. And I kind of get a variety of it. Kind of gets the heat off of me because now this is someone next to you that thought it was important. But I kind of like that method, and it helps me track it. I highly recommend it.
The peer review is important as well. The self-reflection on our part, and self-reflection is a teaching tool. I like to think as faculty, we are all lifelong learners, so I'm learning something all the time from my students, from my peers. It just brings things full circle.
Well, this has been great. We really appreciate you guys coming and speaking with us today about a very important topic that I think you have made very palatable and digestible by our colleagues listening today. If you could leave our listeners with one mindset shift, and maybe it's something you've already said about testing and evaluation, what would it be? So if you've already said it, you can say it again to really make it hit home, but what do you want to say to those listening?
I've said it before, but just to drive home the point of being objective and not emotional, and don't take anything personally. We all make mistakes, and the item analysis will tell us how to move forward and modify, course correct any errors that we've made, and improve questions and minimize ambiguity, etc., to make assessments the best that they can be, because that information for students is invaluable as they move through the program, because the journey gets harder, not easier, as we all recall. So, that would be my take-home point.
And for me, it would be, I feel like many things that we do is really ambiguous, kind of that gray area in anesthesia, patient-specific. A lot of things are really catered to the environment and what's going on. Math is math. So that's what I like about this. Mm-hmm. This is pretty concrete. You know, you have that self-reflection piece, but you could really look at the numbers and say, you know, there's room for improvement here. There really is. Even if the test had a high KR, I guarantee you maybe it wasn't a 1. There's room for improvement. So definitely.
Thank you. This has been super informative and makes me want to learn more about this and dig in. So I think a lot of people are going to benefit from what you shared with us today. Thank you.
Well, thank you for having us.
Thank you.
Yeah, thank you so much. Thank you to our listeners. We thank you for tuning in. We hope you'll tune into the next episode, and we hope maybe if you didn't come to Edge 2026, you'll consider coming next year to Edge in 2027.